Trach suctioning. I'm going to go ahead and demonstrate for you how to suction a trach. And then we're going to start right now. Ready? Here we go. First thing you're going to do is, as you're walking into the room, of course, hand sanitation or hand hygiene. Alright, and then you're going to come to your patient and identify the patient. And more than likely, because the patient has a trach, might not be able to communicate with you. So you definitely want to look at their armband, see the patient's name and date of birth. Explain to the patient what you're going to be doing. They are probably going to be needing and then be pointing or telling you something in regards to needing the suctioning. One thing that you're going to find is the respiratory status would change, it'd be greater. Also, the quality could be labored breathing, and you might even hear them coughing or having some sputum that they can't get out themselves, and that's why you're going to determine the need for them to be suctioned. So you've already identified your patient. You saw the need for the suctioning itself. Then you're going to go ahead, and if it was a patient that was out post-op, you would go ahead and medicate your patient for pain prior to doing the procedure. But remember, airway clearance is important because it's part of our ABCs. We need to get that airway cleaned or cleared as soon as possible. And then you would explain the procedure as I said, and then adjust the bed to your working condition. Since I'm short, I would elevate the bed to waist high, just letting them know the patient you're going to be getting elevated up, explaining the patient everything that you're going to do. So that would be good for me, and then I would of course put down my side rail, allowing me to get close enough to the patient so I am within good working distance. And then I would go ahead and adjust my bedside table close enough so I'm not doing the twisting game with my back, okay? And then also at that time too, you would go ahead and raise the patient a little bit higher to get the patient to sit up higher, so that way proper airway clearance. So semi-fallers to high fallers. Unconscious patient, you would have them laying on their side. And then you of course would adjust them appropriately. Of course, patients move and adjust. Then you bring it close to working height. You would go ahead and place a towel and or a chuck to allow, this would be your working area then, and that way everything's cut. If there's any sputum that gets displaced, you hope to have it on the bath blanket or the towel themselves. Then you would go ahead and make sure your ambu bag is available, and like I said, this is your working area. So you want to make sure that everything is placed there so you can go ahead and reach it. This would be the time you would check to make sure that your wall suction and or Gomco, whichever choice you have to use, is workable and it does provide suction. If not, you would have to adjust to apply for more. So I'm going to go ahead and turn it on and test to see if my suction is appropriate. And this is the sound we hope to hear that shows that it's workable. I'm going to go ahead and turn it off for right now. Some people would choose to leave it on. I'm going to go ahead and turn it off just because of my working area and things like that. Okay? And then now I'm going to go ahead and make sure my ambu bag is connected to oxygen and preparation is completed. Now, the next step we're going to go ahead and do is open my sterile pack, peeling back both sides. And I'm going to be able to grab my sterile container without contaminating the plastic, because this is where you're going to put your sterile fluid. Okay? And then you are going to go ahead and remove it carefully, pouring your saline high into the container and then setting that aside. So that way we have our sterile water. Then you are going to go ahead and I am going to flip this simply because my suction catheter is on top of my gloves. So flipping it will allow me to grab my gloves without contaminating the catheter. So I'm going to go ahead and putting on my sterile gloves, not contaminating, only touching what's going to touch me. Then I'm going to scoop up go ahead and touching now only the side that will not be touching my skin and only the glove. Fixing, because I am sterile, I can touch whatever is gonna touch my hand. So now I have my sterile gloves on. Now, since I'm sterile, I can go ahead and get together everything that I'm gonna need. So what I want to do then is, I am dominant right hand. My non-dominant hand, which is my left hand, is gonna operate this. So what I'm gonna do is apply the Trach Suction. I'm going to gather my catheter. I'm going to not contaminate my sterile hand. I will go ahead and apply first, and until it is into suction, I'm going to test my suction for success. Then I'm going to wrap this, because it's sterile, I want to be able to pre-oxygenate my patient 1, 2, 3, up to 6 times. Go ahead and disconnect. Then I'm going to apply intermittent suction. I'm going to go down without applying suction, come back out with my thumb over the suction, twisting as I'm doing it. I'm only going to go down about this far. So I'm going to go ahead and go down, not applying suction, come up with suction, twisting my catheter. Then I'm going to go ahead and hyperventilate my patient 3 to 6 times. 3, 4, disconnecting. Go ahead and flush my catheter. I'm going to make sure and assess the effectiveness of my suctioning to see if he's still coughing, gagging, respiratory rate, deep breathing, encouraging my patient. Go ahead and hyperventilate again, because he still needs to be suctioned. 2, 3, disconnecting from. Then I'm going to go ahead and suction again, going down, suctioning out. Then I'm going to hyperventilate 1, up to 3 to 6 times, 2, 3, 4, making sure my patient's not turning blue, is coughing. Go ahead and flush your catheter. Then I'm going to go ahead and hyperventilate 1, 3 to 6 times, 2, 3, 4 this time, and go ahead and go down, applying suction, twisting out. Go ahead and hyperventilate, only going 3 times down, 1, 2, 3. Go ahead and flush your catheter. Go ahead and suction the oral airway. Flush your catheter. Then go ahead, once you've already suctioned the oral pharynx, you never want to go back down into the trachea, because remember, sterile technique. You can go ahead and wrap your catheter in your hand, turn your suction off. Go ahead and take your catheter in your gloves, taking your next one off, discarding that away. Make sure your patient listen to lung sounds, assess pulse ox, the status, the rate, and the quality to see if he's hyperventilating or in labor breathing, or if it's shallow respirations, to make sure airway clearance has taken place. And then, prior to that, the patient's doing good, and make sure the patient doesn't need anything else. Move your bedside table back. Go ahead and clean up your suction, your ambu can go back to the oxygen. Take off and make sure the patient is still not having any problems. You've already listened to lung sounds. Then ask your patient if they need anything. If they don't, you go ahead and bring back your side rails. You want to lower the bed lowered and locked. Call it within reach. Side rails up ×2. And then let your patient know, here's your call light if you have any trouble breathing, and you need something for pain, position or potty. that you would be back in an hour unless he calls you sooner. And then you make sure, and then you go ahead and discard all your equipment. And then you're ready for documentation. So now we're back at the nurse's station and we're going to document. In our documentation, we would say the date, the time and military time. We would note suctioning procedure. Trach suctioning was done per policy and procedure in the facility. And then we would describe our appearance of the secretions that we did remove, the amount of the secretions that we removed, how the patient tolerated or his response or her response, and the comfort level. We would document the comfort level, if there was any pain noted, and then, of course, ending our last statement with safety. Bed lowered and locked, call light within reach, and side rails up ×2.